Welcome to Phoenix Rising with Dr. Z. This podcast is all about conversations about healing and rising from the ashes of your grief and trauma. In this podcast, we will be deconstructing and highlighting the different aspects of grief and loss. I'm your host, Dr. Christina Zampatella. Hi, welcome to Phoenix Rising with Dr. Z. Today, our topic is going to be on non-death related losses. Why are we talking about non-death related losses? Because often we completely overlook the fact that they're grievable. Not only do other people maybe not recognize that they're not grievable, but we often don't even understand and recognize that we are in a grieving process as a result of these losses, right? So what are some examples of a non-death related loss? Let's look at these, right? So we already know the loss of immediate family members. Sure, got that. Loss of a job, loss of a home, loss of fertility, incarceration, loss of health, loss of independence, retirement, all of these different kinds of loss. I could go on and on about all the different kinds of non-death related losses. Some of those you might even have recognized in your own life. So what do we do with that? How do we identify the impact of these losses in our lives? So I'm not going to be able to cover every single one of those types of non-death related losses, right? But I'm going to give you an example of the loss that could be experienced in retirement. Isn't retirement supposed to be fun, exciting? Oh my God, we're going to have a party. Here we go. Yeah, that's great. However, in our culture, we are a very individualistic culture. All right. So when I meet you, I might say, "Hi, I'm Christina." Somewhere in that conversation, pretty soon, we're going to say, "Oh, what do you do for a living?" Our identities in our culture are often wrapped up into what we do for a living, right? So I'll be like, "Oh yeah, I'm a psychologist." And, what do you do? "Oh, I'm a dentist." "Oh, okay, great, blah, blah, blah." So we're talking about these things. However, if we go through our lives and we are very in tune with who we are based on what we do, and we come up to a period of time in our lives that we then are going to be shifting into a time where we're no longer in that role, what happens to your identity? "Oh, I used to be a psychologist. I don't know how to address, if I don't have anything going on after, if I don't have anything set up after, how is my life going to change in its organization?" Right? So now I am perhaps grieving the identity that I used to have. And now I'm in this limbo state between the identity I used to have and the one I now need to create as a person who is in retirement. That limbo state, sometimes people don't adjust to that. Some people do not get to a place where they're able to grieve and relinquish their attachment to a previous identity to allow them to move forward and adjusting and redevelop and redefine what their identity is. All right. So that's just an example of a non-death related loss. Other losses. Let's talk about the loss of a marriage or a relationship, a partnership. 50% of us are breaking up or are divorcing. And yet we don't always necessarily see that as a grievable loss. Now, I'm sure for those of you who have experienced a breakup of a relationship, which we won't talk about John Bedwell, who broke up with me when I was 15, and how I feel about John Bedwell. And one day when he sees this podcast, he'll know how much he broke my heart. If you see him anywhere, by the way, let him know that you're watching that and he's there, and I'll mention his name again. So, loss of a marriage, loss of a partnership. What are the things that are grievable in this? All right, our potential futures. This is what I told myself was going to happen when we started this relationship. We were maybe going to start a family. We were going to travel till death do us part in, sickness and in health. We were going to build this life together. We have built a life together. Now we have a family, this unit that we have. It's complicated because we have different parts of this relationship that are linked to other aspects of our lives. So anytime you have one loss, I can't think of any other loss where you don't have other losses that are tied into it. We call those secondary losses. It's actually a term for that. And when I'm helping somebody work through their grieving process, I'm not just talking about the loss that they have. I'm talking about all the implications of that loss and how to come to terms, whatever that means, come to terms with those secondary losses as well, because you have to adjust to them. So let's say loss of marriage. Let's say you have a couple kids. You had a reproductive story too, right? Some of us have a reproductive story like, oh, I'm going to have a couple of kids. We're going to be a family, white picket fence, the house. Some of us choose to be child free. That's still a reproductive story that we tell ourselves. I'm going to talk about, infertility here in just a little bit. But the marriage itself, there's a shift in identity. When I say to you, I'm a wife, you know exactly what I mean. If I were to say to you, or somebody were to say to you, I'm a husband, you know exactly what that means. There is an identity type that goes with that, just like we have identities all over the place. Just like the hat we wear when we're, I'm a psychologist, so to speak. We have this, I am a wife. So now what am I? Well, I'm not a wife. I'm single, but I'm a divorcee. But there's some stigma around the concept of being a divorcee. So how do I want to adjust to that loss? Additionally, the losses. Is there a loss of home? Is there a loss of income? Loss of lifestyle? How do our extended family and our friends feel about this? For those of you who have lost relationships or ended relationships, you might have had a friend group, right? Well, what happened to your friend group? People often feel like they have to pick sides. And when they don't pick sides and everybody is still maintaining those relationships, that can be rather difficult to navigate as well. The loss of the income may really impact the family, might impact the person who's making less money, and also impact the children. How are you going to deal with that process? Sometimes that relationship breaking up can be rather contentious. So now you're dealing not only with the grief associated with the loss of the relationship, but now you're also dealing with the intensity of the emotions that come with trying to navigate adjusting. I keep talking about this limbo period. Anytime you have a loss, you have a limbo period. I'll come back to that. There possibly, if you do have children, both parents might still be alive. And if they are still alive and it's a breakup, the children may have this feeling of, well, maybe they'll get back together, especially when they're younger. But it doesn't mean that they don't experience that same thing as they're getting older. So we've got ourselves a bit of an issue here, is that we don't know how to deal with this loss. That's rather ambiguous, and that's another podcast that we talked about a little bit earlier. And it's kind of not really finite because the parents are still there, right? Another issue that we have is in our society, other than the stigma of it, is there's no ritual assigned. Rituals are huge. When we don't have ritual, it's actually a risk factor for grief becoming stuck. And we're going to talk about prolonged grief disorder in another episode. So we don't have that prescribed ritual. Sometimes when I'm working with somebody, that's actually something that I'll help them do, is help them develop a ritual to be able to find some closure around it. But from a societal perspective, it's not recognized as that. We need our support group. We need our society to give us recognition and provide us validation in order to heal. And often in relationships that are ending, you may not even get that opportunity. And what if the relationship was abusive? What if it was contentious? What if some person was having an affair? You may have other people around you go, oh, God, thank God. Thank God you got out of that. No, thank God. Like, okay, maybe there's people who are like, oh yeah, I needed out of this, but there's still that grieving process of the relationship you wish you had. So it gets rather complicated when we have a loss of a relationship, and we have to give ourselves the permission to experience our grieving process. And maybe, hopefully, as you know, you've listened to the podcast where we talked about there's no 5 stages of grief. Certainly, this would be a very challenging loss to put within that structure, that prescription that actually doesn't really exist. So what does that grieving process look like when it is an ambiguous loss? That's another challenge that we have. All right, there's that one. Let's talk about job loss. I'm going to bring up job loss not only because it's important to talk about, but since COVID, the amount of loss of jobs has been exponentially higher than what would be seen when we weren't in the pandemic. Let's talk about this. First, how was the job lost? Was the person fired? Were they put on furlough? Was it retirement? Did they lose their job because they did something really wrong? Did they lose their job because the organization closed down? If you think about that, how would you feel about talking with somebody who lost their job, and how you would feel about each one of those types of job losses if you talk to different people? So, okay, let me put that in English. If you're talking to a person, they got fired, and they got fired because they were embezzling money, you're going to have a feeling about that. If you talk to another person and they lost their job because the place closed down during the COVID, you're going to have a whole different feeling about that, right? One feels like there's some kind of fault. The other one does not seem like there is fault. Again, going back, our identities are often tied up into our jobs. And when one gets ripped away from you, there's no anticipation. You know, sometimes in a relationship, when there's a relationship loss, you're kind of going through it, a lot of stuff before that relationship breaks up. Not always, I get it. But usually there's quite a bit there. So you've already been possibly going, oh man, what's going to happen if this relationship breaks up? You may not have had that with your job. So there has been no anticipatory process in order to prepare yourself for what this is going to mean for you. Loss of income. What if you don't have savings? What if you are struggling with the fact that you are 60 years old, you've lost your job, and as much as we'd love to say there's no ageism, there is. Are you going to be able to find another job? What if you're in the middle of COVID? Where the heck are you going to get another job? What kind of jobs are open? This has happened. This is not stuff that's like we're just, theoretically putting it out there. These are the kinds of things that are happening. A loss of job also can impact your social relationships because, as I mentioned, you have your identity maybe tied up into this, but other people see you in some way. So if I lost my job as a psychologist and I could not get a job anywhere else, and I decided that I was going to become a cashier at a grocery store, nothing wrong with that. I'm just saying the massive shift in what that means. How is my society seeing me as a result of that? The change of income, the other secondary losses that I'm potentially looking at. And believe it or not, in higher socioeconomic status communities, the loss of a job, now hear me out, the loss of a job has a greater impact psychologically than those from a lower socioeconomic status. Okay, wait, I know you might have your panties in a bunch right now. Don't do that. Either way, it's devastating. In lower socioeconomic environments, job loss is more common. And low socioeconomic statuses are low socioeconomic statuses, not going from a high socioeconomic status to potentially a low socioeconomic status. So it's not great that it's like, hey, yeah, this is common, but it's interesting how research has found that you would think almost it would be the opposite way, right? Like, hey, I lost my job. I'm from this low socioeconomic status. I'm starting to climb my way up and I lose my job and it's devastating. Guess what? It is. It's absolutely devastating. But it's interesting how the research supports that dynamic. And again, no ritual. You may not even want other people to know. You might be absolutely ashamed about what happened. Absolutely ashamed. So job loss, big deal. It's a big deal. Let's talk about loss of health. I shared this with you in my introduction podcast that when I was 20 years old, I was diagnosed with epilepsy. Now, that's a massive disorder. It's one that has a ridiculous amount of stigma. I mean, at one point, they used to put people in psychiatric hospitals if you had epilepsy. There was one place in the Northeast where there was just an entire mental hospital to put people in who had epilepsy. Other cultures, some cultures think you're a shaman. So I think I was born in the wrong culture. Somebody be thinking I'm a shaman. There are other cultures in which you are cursed. I mean, the breadth of how that is interpreted, but either way, there is stigma around it. It's scary. It's scary to see somebody have a seizure. So nonetheless, all of this is going on in my head, right? This big emergency. It's terrifying to come out of a seizure. If you have epilepsy, you know what I'm talking about. But how that changed my life. Now, when I was 20, I probably wasn't real smart about it and still did dumb stuff that I had no business doing with having epilepsy that wasn't maybe very controlled. All right. Now I'm lucky enough to have epilepsy that is controlled. Many of us do not. And there's a good amount of people that have epilepsy. One in 26 people will develop epilepsy. Anyway, I digress. Loss of health can become problematic on multiple levels. First off, depending on the trajectory, there's lots of different trajectories that are associated with the dying process, for example. So let's say you have a chronic health condition, chronic, straight across, right? This is more about learning how to live with that chronic condition that may dip down, but might come back up, right? Because there's some type of intervention that's going to be able to maintain your level of functioning and get you back up if you start to drop. All right, that's one type of grief. Learning how to live with this non-finite loss that is impacting your life. In what way? You have to address that, right? Believe it or not, I just don't take baths. I shower, don't worry, but I don't take baths because I don't really want to be in the bathtub. You've seen famous people actually who have died from that. What if I have a condition that is progressive and kind of starts, up here, you're healthy, then it dives down, then it kind of levels out and it dives down again, but maybe it gets better. And then you get some hope and then it dives down. That up and down trajectory is extremely difficult to navigate, not only for the person who has going through that dying process, but also for the loved ones around them and their caregivers. Because as a person is passing and they're declining and they're functioning, you may find that the people around them pull away. You would think they'd get closer. And some people do. But a lot of people pull away, as in this anticipation, preparation for you not being in their lives anymore. And maybe that's when you need the social support the most. And then you're declining. And then all of a sudden something happens and you're increasing and improving. Then there becomes this hope. And you try not to hang on to the hope, but who wouldn't want to be hopeful? And the people around you, oh, this is hopeful. This chemo is working. And you sit there for a while. And maybe life gets a little back to normal. But you're sitting there with that anticipation, that fear, that inkling that you're carrying with you, that potentially something can go wrong. And like any kind of dying trajectory, you might nosedive and die very quickly. There are some kinds of losses, obviously, that result in death. And I'm not talking about chronic illness, but I'm talking about those illnesses in which the person gets sick, there's some kind of issue, and then boom, an aneurysm, and then you pass away. That's where we're dealing more with a finite loss. But when we're talking about a chronic health condition, when we are talking about a condition that goes up and down, that you're unable to engage in life, they have what is called living losses. You are living with these losses. Maybe feeling a little surprised that the medical community cannot fix you. Right? We live in this industrialized culture that really expects that. With our modern medicine, we should be able to fix anything. New things are coming out. New trials are coming out. Before the Industrial Revolution, it was more palliative and hospice care. Afterwards, now the doctor's the bad guy if he or she cannot fix you and make you healthy. And unfortunately, in our medical community, I don't want to get on my soapbox about that, but in our medical community, they're not even taught at all how to deal with any kind of grief. But I I digress. I'll get you there. I just take the scenic route. So here we are talking about chronic conditions and the struggles that we have with trying to live our lives to their fullest while also trying to navigate maybe pain, fear, anxiety, hope, loss of dreams, all those secondary losses that I was talking about before. Again, non-death related losses. Can you grieve something that hasn't happened yet? What about a brain injury? I was talking with somebody earlier talking about the loss of how the person was before he had the brain injury. You grieve that person. Then you see little glimpses. You're like, oh, there he is. But then there he's not. And it's hard to adjust to the changes in the personality that that person is exhibiting. And so there's the grief of the loss of the person that you had, but the person's not died. So then you get this message from people of, well, you shouldn't be sad. He's alive. Of course I'm sad. Of course I'm grieving that. Somebody who has dementia or Alzheimer's. We don't know the end of that. We just know that that person is slowly not functioning and not recognizing who I am and is scared and maybe becomes aggressive. You're grieving the person they used to be before they've even died. So chronic progressive illnesses have a massive amount of grief surrounding it. And I think the last one I'm going to talk to you about, there's a few others I wanted to talk to you about, but for the sake of time, I want to talk to you about spirituality and religion. Because often when we have a loss in our lives, you'll hear people say, oh, I'm angry at God. Yeah, I get that. Some people get closer. Some people get closer to God or whatever their higher power is. But some people don't. Some people lose their faith. And there is something called complicated spiritual grief. I'm going to come back to that in just a little bit. But here we have somebody who perhaps that there was a tragic loss. And all of a sudden they start going, wait a minute. And I'm going to use the term God, okay, with the understanding higher power, all right? God's supposed to be a benefit. How do you say that? It's supposed to be good person. It's supposed to be a good influence in my life. That word will come back to me after I'm done the podcast. So hang in there. I'll just chime right in. But he was supposed to be kind and loving, and I lead a good life. You know, some people will say, I'm a good Christian, and God should protect me. Is that what did I do wrong to deserve this? I've worked with people who have felt completely abandoned and just questioning, I don't get why God is punishing me when I've lived this really good life. Benevolence, there's the word. Okay. The benevolence of God gets challenged and gets questioned. And why would I be so betrayed by God? Don't get it. What if the community around the individual, in the religious community, let's say they're in a religious community, what if that community is not supportive? I've worked with people who have had different losses. For example, somebody who has lost another person to suicide, died by suicide. In her religious community, they would not allow her to bury that person in their cemetery because it was a sin, according to them. So they were abandoned by their religious community at the same time that this person lost their loved one. And beginning to challenge, God, why would you do this to me? If I'm if I've been a good follower, I don't understand. This loss of faith, not only in God, one's higher power, but also, like I said, the loss of faith in one's community. So you lose the support that you need. You lose a belief system that could be used in order to cope with the losses that we have. We do know that people who have a belief in any kind of higher power, research shows that they actually cope better and come to terms and process their loss a little bit more, with a little less suffering than those who have no belief system. To me, a belief system, that's a big word. If you have meaning in your life, that's a belief system. But anyway, conversation for another day. But let's talk about the fact that, maybe it's very confusing that you feel like you have been punished by God, you're being punished by your community, and now you have a question about, well, who am I supposed to turn to, or what am I supposed to turn to in regard to my feelings about a higher power? Complicated spiritual grief is when a person has a significant amount of the sense of disengagement with their higher power, feeling as if they've been betrayed, that they're being punished, that they've been lied to. I was a good person. I'm supposed to be loved, which means I'm not supposed to be punished. When that betrayal occurs and you carry that betrayal along with this lack of support from the religious community, a lack of a place to go in order to engage in your activities that you had every Sunday, every Friday, every Saturday, whatever you did, where is that community anymore? So now you're losing routine. You're losing routine, support, and you're having this existential crisis that's occurring as a loss that is not death related. So folks, give yourself permission to grieve those losses that are not related to death. I could go on and on. Loss of the parent you wish you had. Loss of a limb. A loss of independence. I remember working with somebody who her cognitive functioning was starting to decline. And as a result, they took away her driver's license. She's a fiercely independent woman. And now she has no ability to go anywhere on her own. She doesn't live near mass transportation. She didn't have much of a social support. So now I've got somebody who's completely, boom, sequestered into her home. Other people I've worked with. Oh God, you know what? I'll just talk about my husband's grandmother, who my mom's the shit. I love my mom. She's great. She's no joke. She don't take anything from anybody. But she has gotten very elderly and physically has not been able to take care of herself. And she's had falls. And, like I said, from a physical standpoint, she's not safe to live by herself. So I would say about 6-7 months ago, she was placed in a nursing home. And we went to go visit her. Well, when I went into the nursing home, I'm looking around. I'm like, oh my God, this woman had this beautiful home, pictures, memories. She'd been in there for over 40 years. She was married. She lived with her husband there. She raised her children there. And now she's got a bed and an armoire and a window. Looking at nothing, by the way. There's nothing out there. And she came in. So we were waiting for her because she was coming to visit. We were coming to visit, sorry. And then she came in the wheelchair. And I just started crying. Now, I can cry pretty easy, commercials, all these things. But I started crying because then she started crying. I've never seen this woman cry. So she's crying. Now I'm crying harder because she's crying. Then we finally calmed down and we started talking. And I'm like, this must be a massive shift for you. And she just nodded her head. I'm like, is anyone talking to you about this? About all the things that you've had to give up in order to be here? And she just shook her head no. And I said, I want you to know that I recognize and can only imagine what this must be like for you. Losing everything all at one time. All at one time. Boom. One move, one swipe. She even said, oh, somebody brought me clothes. They must have just picked anything that they could get their hands on because that's nothing that I would even wear. Couldn't even pick her own clothes. But then she kept saying, but this is for the best. This is for the best because my health isn't good. So if she wants to kind of reframe that for herself, I'm not going to yank that away from her. I think she was trying to find a way to come to terms with the intensity of that loss. And it's a whole process. She wouldn't engage with anybody there. And now she's starting to play bingo. I think she's pretty badass at bingo. She's winning some cool stuff. I don't think she's winning money. I think she's winning candy. That woman loves candy. Actually should go over there because I love Reese's peanut butter cups myself. And that's how she's adjusting to that. But also a non-death related loss. So look around you. What kind of losses have you had in your life? One way you can explore this, and I'll end with this, just something that you can do to kind of examine your lifelong process, looking at your narrative. Take a piece of paper, write birth on one side and put your age on the other side, and put a line and identify all the times that you've had a loss. Age 5, I lost my dog. Age 7, we moved. Age 11, my grandfather died. Age 13, 14, John Bedwell broke up with me. John Bedwell broke up with me. And moving on. I'm actually okay. I love my husband way more. And then just going through. Take a look. Look at your narrative. How did you grieve those? Did you grieve those? Did you even identify that they were a loss? If you grieved them, how did you grieve them? Do you think you effectively integrated those losses into your narrative? What did you learn from it? How did you change? How did the people around you help you? Did you make any meaning from that? Did you find any benefit from that loss? Have you been able to make sense of what you've gone through? Have those things. How has that changed and made you who the person you are today? Which losses are you not looking at? Which ones are you avoiding? Why are you avoiding it? What is the purpose of avoiding those losses? So that's called a loss line, something I like to do with people, something that you can do for yourself. And if you want to examine that a little bit more and you want somebody to help you walk through that, certainly reach out to somebody who's trained in grief, and or even just talk to a friend of, I just started thinking about all these losses in my life and all the growth that has occurred as a result of that. All the traumas, all the growth, these post-traumatic growth, all these losses and how I grew. And this is here where I am today. And what's not. I'm not going to say grief resolves, but it does integrate. How have I integrated this? Did I redefine my life goals? Have I found a way to take those losses and carry them with me over time, where they maybe have bittersweet memories and mean things differently as I move through my life? I'd be curious as to see what you find. Bye. Thank you for listening to Phoenix Rising with Dr. Z. If you found this podcast helpful, please share it, subscribe, and leave a rating or review wherever you get your podcasts. We want to be a resource for anyone who's experiencing loss, and this is a simple way you can help us spread the word. Check out our show description. There you'll find a link to connect with me on social media, as well as helpful articles and resources.